Hello, my name is Rakisha Rushing, and I'm going to be demonstrating a skills video, which is to draw up insulin. For my supplies, I have my two working gloves, my alcohol prep pad, a gauze, my regular insulin, and then my NPH insulin. And I also use a 1 milliliter syringe. Alright, so before I get started, I am going to list out the 6 drug rights, which is the right patient, the right time, the right dose, the right medication, the right route, and then the right documentation. Next, I would compare the medication given to the patient's MAR to determine I have the right doses and the orders that the patient will be receiving. So I would check that momentarily. All right. So once I have this verified, checked, and I match my patient to the MRR record, I know I have the right patient and the right medication and the right orders for this patient. So for the first thing I would do is give these two medications a mix because they've been sitting around for a while in the medication pixes or what have you. So then I would just give the couple of shakes in between my hands to warm it up and get things reconstituted needs to be, or remixed how it should be. Alright, so my medication is mixed. And the two medications that I do have, again, is one is an NPH insulin, and this insulin is to, for, let me back up here, insulin is to treat blood glucose levels to ensure that they get enough oxygen, glucose to the cells of the body. So, having the appropriate amount of glucose is vital for survival and cellular respiration. I'm going to check my patient's blood sugar levels. So I'm going to enter my patient's room, hand hygiene. Hi, my name is Rakisha. I'll be the nurse taking care of you today. Can you please verify your name and date of birth? Perfect. So I verify my patient. This is patient Jane Doe. Date of birth is April 22nd, 1993, and that matches my MAR records. Mr. Jane, I have two medications for you. One is going to be a fast-acting insulin, and the second one is going to be a delayed action insulin. And so these medications are given to help control your blood glucose levels. So prior to me administering these medications, I'm going to check your blood sugar to ensure that your blood sugars are within the appropriate levels. If they are not, such as if they're too high, I'm going to give you 4 units of the regular insulin and then 8 units of the NPH insulin, which should be a total of 12 units. And then after you receive your insulin, if you need it, you'll receive your breakfast tray in about 30 minutes. All right, so we're going to go ahead and get started. I'm going to put some gloves on. Are you okay with me checking your blood sugar this morning? Okay. Take your index finger, check it, squeeze it out. Okay, Mr. Johnson, so your blood sugar is a bit high. Right now it's saying 140, which is very high, and you want it. And I typically like to see your blood sugars around anything under 100. So 70 to 90 is what I kind of like to see. Since you are so high, I will be administering 2 insulins. Like again, it's 4 units are going to be the regular and 8 units of the NPH. So first, I'm going to start with cleaning these 2 vials with the alcohol pad. And I'm going to take my syringe and I'm going to draw up 4 units of air for the irregular. I'm also going to have my nurse Stacy with me, or another nurse with me, to verify that I am drawing up the correct amount of insulin, because I know that overdosing or underdosing can be fatal to the patient. So this is why we always have 2 nurses when administering insulin. So I have 4 units of air. You can verify with me as well. This is 4 units of air. Safety off. Move the needle. Check 4 units. Now I'm also going to pull up another 8 units of air. See, there's 8 units there. There's 8 units of air. Injecting to that vial. I'm going to go back to this first vial here and pull back 4 units. And 4 units. Ensuring I have no air in there. I'm going to take my next vial and draw up 8 units. There's 8 units there. So a total of 12 units injected. Or injected, pulled up. And I'm going to put the top back on here. Okay. All right. So, Ms. Jan, I have that medication drawn up, but I wanted to verify, do you have any allergies to any medications, seasonal allergies, into food, environmental allergies? No? Okay, perfect. Patient has no allergies. And I also want to verify that name and date of birth again to match my MAR records. Okay. All right. So I have successfully drawn up 12 units of insulin, which I have here. And I have my second nurse verify that yes, we do in fact have 12 units of insulin, 4 units of regular acting, 8 units of the NPO. My patient has been educated on insulin and how much they were receiving, and what is the normal parameters for the blood sugar. That's it for this video. Thank you.